So I'm delighted today to have Dr. Jonathan Gómez Raja with me, and Jonathan is the Chief Scientific Officer at Fundesalud, which is the research foundation with the Regional Ministry of Health and Social Services at the Government of Extremadura. So Jonathan, can I ask you to tell us a bit about how the healthcare system in Extremadura is organised?
Yes. Well, the situation in Spain in general regarding the healthcare system, it's very particular. I mean, it's basically the system is a copy pasted from the NHS model. So, but the difference is in Spain we have 17 different regions, and the healthcare system belongs to the region. So in Extremadura, we have our regional healthcare system, and it's organized in 14 different hospitals with more than 113 community health centers, 420 primary care centers. The thing is, all the centers in the healthcare system are connected by the same platform. They are managed by a powerful healthcare information system, providing, electronic health records and electronic prescription and integrated medical record in general between primary care and specialized care. And then another particular thing regarding my system is, in comparison to other regions that have, for example, different hospitals with different systems and also with different organizations. So my healthcare system, the regional one, involves all. So it's only one organization for all the hospital and all the primary care centers, and also it only has the research foundation, my foundation, Fundesalud, managing the whole system as well. If you go to another regions in Spain, you have, for example, one hospital with one foundation managing the research and innovation programs and projects. So in my region, we only have my foundation, Fundesalud, managing all the research and innovation projects and programs in the region.
Thanks, Jonathan. And Extremadura is quite a large and sparsely populated region. So I was wondering, what systems or programs do you have in place there? And I think you may have already touched on some of that in your previous introduction to the healthcare system there. But what systems and programs do you have in place to ensure that the entire population are able to access care when they need it? And also, given the aged population in Extremadura, within those systems and programs, is there a focus on prevention?
Yes, Extremadura is a very vast region. So basically in size, it might be like Austria, but it's much less populated. So that means we have a lot of people living very dispersed. So they are living, mostly 75% of the population are living in localities, in municipalities with less than 50,000 people. So we have a really dispersed population. That means we need new programs, new system to cover all the population. And for that, we are promoting remote monitoring. So, and we have different strategies to already implemented to cover up that. So one is we have an app, an app, and application available where you can consult, you can set up an appointment with your consultant, you can check your clinical records, your lab tests, your reports, and all the resources in the system. And it's also very interactive, and you can get reminders and other things regarding appointments, or for example, your treatments. You can get also reminders. Second thing, we have a telemedicine program, very, very powerful, very strong. Basically, is used now to connect, for example, patients and nurses' homes to the health system, to the healthcare system, for example, with the consultants in the hospital. We also have a very good prevention program. Prevention is very important for us. Although in general the funding and resources allocated to prevention is not always enough. But we have a school for health education, but again, so the funding is not enough in my opinion. And finally, we have research and innovation projects funded by the European Commission by the Horizon 2020 project, focused also on these monitoring and prevention programs. We have one project called Essence, which is actually a COVID-19 project funded by the European Commission. And it's basically a system to monitor people at home during confinement, during the lockdown, and to promote also education to those people that are under lockdown because of the pandemic. We have another project called Crane, which is focused on pre-commercial procurement for chronic diseases in rural areas. So, which is really important for us regarding the dispersion of the population. And then we have another project called the Rural, that is basically a marketplace. We are going to develop a marketplace to provide a healthcare solution and also another solution in the market for people that are living in rural areas. So it's kind of, we are providing resources remotely to those people that are really far away each other, or sometimes they have to drive like 150 kilometers to get into the hospital. So and additionally, we have the School for Health I already mentioned, and we are providing content in a web page, and also we are using social media to disseminate the message about that.
So I think it's safe to say that prevention is a priority for Extremadura, from that answer that you've given, and you've touched on some of the programs that Extremadura is involved in. And why do you think it's so important that preventive medicine becomes embedded in everyday healthcare?
Well, as a public system, for example, our system is failing as the beverage model. So we need to invest in prevention. It's not like the Bismarck model. So we need to avoid people coming to the hospital. We need to avoid people consuming resources, because our system is funded by taxes, is funded by the government, and the budget is limited, as you might know. Our system is organized in different health areas, receiving the budget based on the population they're covering. So if we invest in prevention, healthy lifestyle, disease and self-management, active and healthy aging, and so on, we can save resources in the end. So investment in prevention is key for us, but again, it's not funded as it should be, in my opinion.
So if I can ask you a little bit now about best practice, and sharing best practice is one way of identifying and assessing different approaches to implementation of preventive medicine. How important is it best practices shared, particularly in the area of prevention and even personalised medicine? And in Extremadura, do you collaborate with any other regions to share best practice?
Yeah, it's so important. Sharing information and best practices is really important. It might be the starting point for a potential implementation of new things in one territory, in one organization, one system. Although not always a practice that might be implemented in other territory might work in a specific place. However, good examples might be adapted anyway in new territories or sector. And also we have to consider cultural differences as well, not only regarding organizations. But for us, it's very important. We are participating in different projects, sharing experience, sharing best practices, and most of them are implemented after the project or after the change. We are participating in Interact program. Interact program usually works on that, in sharing, in exchanging practices and policies and so on. And we are very active in this program, especially with south of France, because there's a cross-border cooperation, south of France, Spain, and Portugal. And we basically have the same system, healthcare system, so we are very active in that.
So really, as a final question, I would like to ask you a bit about policy, and what, the regional policies and support mechanisms that exist in Extremadura. Are there any there that particularly focus on and help with support of preventive medicine initiatives?
It's very important. In the end, as I mentioned before, it can be a potential cost saving when you implement this kind of a preventive medicine initiative. Healthcare systems provide health, not only care or fixing health problems. Usually, the system are very much focused on fixing the problems instead of avoiding these problems appear. So promotion of health and keeping the health status as fast as possible in the population should be an important key activity in our health system. And for that, primary care is key in that. And also, we are also sharing new initiatives regarding a new concept which is called community pharmacy or something like that, which is also to put the pharmacies in the healthcare system as well, and to provide resources and to provide experience and so on, also in the healthcare system.
Thanks, Jonathan. So we've reached the end of the interview now, and I would just like to thank you for joining me today and giving us an insight into Extremadura and the preventive medicine approaches used in Extremadura. Thank you.
Thank you so much for the invitation. It was a pleasure. Thanks.